Jobs stepped down from Apple earlier this year after a lengthy battle with pancreatic cancer, and doctors say there have been small advances in research, but there is still much to be done to help with early detection. WBTV's Derek Rose is live outside Presbyterian Hospital this morning with information doctors say, Derek, can help you and your family get a head start on this deadly disease.
Christine, you certainly have to look at the timing of this story. We are obviously in a Cancer Awareness Month, but the type of cancer Steve Jobs had, doctors tell me, was not a typical disease, just like Steve Jobs was not a typical person.
But it is, unfortunately, one of the most deadliest forms of cancer.
Dr. Fowler tells us that's mostly because of the lack of screening tools for the disease. Survival rates, he tells us, are much lower than that of other forms of cancer.
80% of people are, at the time of diagnosis, are beyond the stage of which we think we can cure with surgical intervention. So 80% have stage 4 disease or bulky stage 3 disease.
Still, there are things you can look for. Family history is the obvious head start. There's also unexplained weight loss. Another flag is jaundice or a yellowish tint to the skin. Also, Fowler tells patients to have any abdominal problems checked out. Dr. Fowler wishes there was more to do, and he certainly has tried in the last 20 years fighting pancreatic cancer in his role as a surgical oncologist. Sadly, though, he admits the losses have been far too great.
It's disappointing anytime you fail. I mean, we as surgeons, we like to be successful, and the disappointment for us, both in dealing with the patient, that's a family, that's a husband, that's a wife, and it's a disappointment when we're not successful.
And because research funds are so critical when it comes to finding the early detection tools for pancreatic cancer, Dr. Fowler tells me it is up to the lawmakers in Washington not to cut funding to organizations like the National Institute of Health. Christine?
Thank you for that live report, Derek.